Hello. So I'm here with Elrina in the studio.
Pretorius.
Pretorius. I keep doing it. She's married now. And we are talking again about pelvic floor and especially coming into perimenopause. And we thought we'd talk a bit specifically about birth trauma and how birth trauma can show up again in midlife. So
yeah,
what have you got to say about that?
Well, I think because both of us treat women pretty much from, I mean, you were doing more prenatal stuff when I met you, weren't you?
Yeah.
And that's still where I see some mums, and obviously with the mummy mots, you see lots of mums with birth trauma, but I also treat menopausal and postmenopausal women, so perimenopause and postmenopause. So what you see is that sometimes these women are coming in with issues which we then identify actually happened so long ago in their birth trauma. In fact, I just remembered that's actually how I got into perinatal care, was because I was seeing all these women who were coming in their 40s, and when I asked them, when did your back pain start, when did your hip pain start, it actually started when they had their kids, and it was never treated because it's such a busy time. You've got 2 or 3 young kids running around, and you might have some birth trauma, but it isn't a priority to be dealt with. And then 15 years later, when your estrogen levels start dropping, and there's probably a little bit more time and money for you to take care of you, and that estrogen isn't in the muscles and the ligaments and the tendons anymore, and it just shows up so much more as you go through those years. That's when, one, you have the time, effort, energy to go and spend on yourself, but 2, that's also where it really starts showing up and it becomes life limiting.
Yes.
Which is where you have to deal with it. You can't continue to just cope with it.
And I'm just touching on that. So I had Sophie and Patrick, one a cesarean birth, emergency cesarean, and then I had a completely natural VBAC 14 months later. And their births were kind of why I became a yoga teacher, and I started specialising in prenatal training. And then I had Olivia 7 years later at 40, and that was when I had gone into labour at 24 weeks and it was on bed rest for ages, and ended up having a split pubic bone and birthing with that condition, which meant that there was some pretty sort of emergency intervention, and I got damaged, and my recovery journey from that was why I started Yoga Mums and started really focusing on other women's postnatal recovery journey, which is how we met, really.
Yes.
And it was then that I started completely changing the way that I teach yoga birthing as well, because understanding what we can do potentially in birth to prevent damage in actual birth, and also that golden window of postnatal recovery healing that we have, because then, of course, once, and this is my story, yes, I recovered and I did all the work and I was very, very focused, did the work. Then I got to 45, 46, when I didn't really understand all the symptoms that were indicating that I was in perimenopause. I knew about it intellectually, but not sort of, I wasn't connecting the dots.
Like it was for you.
For me, exactly.
Yeah.
And then I had a situation where, because of extreme intra-abdominal pressure, and obviously the band of muscle, the levator ani, which holds the organs in place, had been damaged with me, with having to get up there,
get the baby out,
and then with big intra-abdominal pressure, I had a situation where my bladder did prolapse. And the thing is, it's so common, isn't it? Because once you lose that. Once the elasticity because of the lack of hormones, it's not just your bones and your skin elasticity and your
I think, and it's also ironic, isn't it, that when you need it the most, you're going to have it the least, isn't it? When you really need, the older you get, the kind of more you need things to be held together. It's kind of when you have it the least, isn't it?
Yeah.
Estrogen.
Yes.
And estrogen is, makes the muscles stronger, makes the tissues more flexible. So it is such a key thing. And also when you're breastfeeding, your estrogen levels are really low. So when you need that for your recovery, you kind of don't have it, do you? So it's only once you stop breastfeeding that you can really start normalizing the estrogen levels and getting the body back into some kind of harmony, which is why protein is so important, which we'll talk about a lot in terms of diet and hormone regulation.
And you think about other cultures, like I always say this when I am teaching my yoga birthing stuff, that pretty much every other culture in the world apart from ours, in that postnatal period, there is this kind of 4 to 6 week baby moon where the women are bound to bring back the muscle fibers. You are fed different broths which are very rich for the for the blood, for the iron levels, for the protein, for the collagen production, and you are known to be in this stage where all the other women come together and help you to heal.
I don't know if I mentioned this before. In Malaysia, there's hardly any incidence of diastasis and prolapse because these women have, I think it's almost a year of where they're so taken care of.
And if you think about, we're in such a state of depletion and injury, and this is a big thing that I don't think many people really understand is, if you had a very badly sprained ankle, it's a long recovery. You're not going to go running on that ankle for quite some time. You understand that it needs strengthening, releasing, strengthening again, releasing again, really. And
then slowly integrating back into your sport or your life. Whereas when you come home with a baby, especially if you've really got a toddler at home, you picking up and pushing, pulling, carrying and doing all these things that your body is definitely not ready for, whether you've had a vaginal birth or a C-section. So with the C-section, mums are told for 6 weeks not to do X, Y, Z. Well, I can tell you now, a lot of them are doing those things long before they see me at 6 weeks. They've already, what do you do if your toddler cries and needs to be picked up? Your baby's
not going to say, you're on your own, kid.
Yeah, exactly. So I think having that extra family support or friend support is so important if you can get it. It is sad that we live in such a separate society that we no longer, I'm South African, so, and I didn't have parents that could help. I don't know if you did, but when you had your kids, but it's quite difficult, isn't it, to get yourself back to some state of fighting fitness when you're on your own and dealing with a child or 2 children. So
that's that. I think also just acknowledging the fact that if that is the situation for you, you're not alone. In fact, you're in the majority. And what we're seeing now, in midlife, when, like you just said, when women are going, do you know what, I can't live with this hip pain anymore, or my back pain has meant that I haven't slept through the night for a decade or more, and finally the kids are sort of at school, and I can have 5 minutes to think about myself, or I am ready to, when it gets perimenopause, we often find that suddenly we're leaking, etc. as well. So suddenly it's like, I've got to go and see somebody about what's been happening for a long time.
I think we're lucky in that we see the women who seek help, but there are so many women out there that don't even know that there is help, or don't access it for one reason or another. So it's so important to recognize that these things are absolutely treatable. And sometimes just by changing some small things, you can make massive differences to your outcome at the end of the day. Whether it is the way you do things, the way you move, maybe looking at some HRT, maybe looking at the changes in your diet, looking at some sleep hygiene things so you get that sleep so your body can heal. There's so many things that you can actually do to help yourself, but if you don't know, I think in some cases you don't even know what you don't know, you just live with it, don't you? So I think we're very lucky in that we see the women who seek help and that we're able to give them this advice. But what's so important is for us to spread that message even further so that people know that help is out there.
Well, for all of you guys, ladies watching this, and certainly the woman in the women's wellbeing.me space, I say it is up to us at a grassroots level, not just us, but all of us. Like once you know about breathing, about posture, about the knack, using your diaphragm and your pelvic diaphragm together, once you have a little bit of an inkling of all of these foundational tools, you've got to spread the word. You've got to tell. I had a one-to-one with a lady a week or 2 ago, and she has been putting up with really severe pain for 17 years, and she has been going to see different professionals, and no one had ever mentioned a pelvic floor physiotherapist. I was saying to Elrina, she had no lumbar curve left, so her lower back was completely flat, glutes were completely atrophied, and she had significant pain, and of course she did. Like her posture was horrendous. How could she not? She's just literally shallow breathing up here, very anxious person. how could she not have pain? And then she described her birth, and I was like, well, cool. You've got so much stuff that needs to be released there. She had never, ever, ever heard of a pelvic floor physiotherapist. None of the professionals, none of the GP, no one had ever mentioned that there's people like yourself that can help us. Like, that's...
Well, I mean, that's partly why we do these podcasts, isn't it? So we can get the word out there and, you know, take an hour out of your day and actually spread the word a little bit and put those posts on Instagram and Facebook and all the things that I don't love doing. But it's like, how else are people going to know about this? I'm very lucky that I've got quite a few professionals in the area, osteopaths, chiropractors and so on, that refer to me, that do get what I do. So if they've got those patients coming in with the chronic backs, and especially their female population with the chronic backs and the chronic hips, that they understand, and knee pain is a big thing we see as well. In my postnatal and menopausal women, is often knee pain that brings them in, but they understand that what they're doing isn't going to make the difference, because often it's internal trigger points, tension patterns in the adductors, deactivation of the glutes, and it's a pattern. I can almost predict when I see that woman walking in what I'm going to find in her pelvic floor, to the point that I often think, do I really need to do the pelvic floor exam, because I actually know what I'm going to find. But then again, sometimes it surprises you, you know, you find something completely different. So there is value in it, but it's the release work that needs doing. It's understanding how the breath impacts on your pelvic floor, which is the work Linda does, and understanding how getting those adductors to stretch and deactivate, so we're not kind of overusing them, because that, you know, shares attachments with the pelvic floor, then you get that hypertonicity. And understanding that something like stress incontinence doesn't get better on its own, and we don't have to accept it. You know, pain, you don't have to live with pain. Maybe you're going to have a level of discomfort one day. And Linda and I've been sitting here chatting, and we jumped up because she has hip pain and I have back pain. So
it's like, we're not supposed to be sitting for
an hour.
We're not supposed to do that. Our bodies are not physiologically designed to be in a static state, especially like this. So
so just understanding those movement patterns have an impact on you every single day, and how you habitually do things have an impact, but you can change a habit. And through the education that Linda and myself do, is changing how you go from sit to stand, changing how you lift, push, pull, carry, that can have a significant impact, changing how you breathe when you do those things, changing how you connect with your pelvic floor. All of these things have an impact on how much pain you will experience. But it's about what your line in the sand is, isn't it?
Yeah. It's interesting when I have mentioned, and to me it's like one fact out of many facts, but when I talk about the incontinence issues in nursing homes, and you know, that seems to be something that people go, whoa, I don't want to be in a nursing home with incontinence. And I'm like, well, tell you what, that's what takes most women into nursing homes, and you got to do something about it now. It's not going to get better when you're 80. No, do something about it now. But can you just speak a bit more about the knee pain? Because I've knee pain and shoulder pain, but knee pain in particular, and how, if you're also getting that sacroiliac kind of sharp pain and adductor tightness, because we see that in a pattern, you know, it's a pity I don't have my little model here, because you can really see it on the model. Is what do you want a pelvis? Yes, maybe I've got a pelvis. Let me just. So I think what we need to understand is the interconnectedness of something like your adductors that are attached to your knees and to your pelvis. But the bladder and things are out, but
there we go, that's fine. So if we look at this bone here, you know, just on the outside of that bone is where your adductor attaches. So if you've got adductor tightness, you're going to have reflexive tightness here as well. If you've got an older episiotomy scar here, you have tightness there, you're going to have tightness in the adductor, or the other way around. So which is it? We don't know, chicken and egg, you know. But it's a question of understanding that these are muscles, you know, these are muscles. They go from one bone to the other bone. So if we talk about musculoskeletal system, this is part of your musculoskeletal system. Just because there's organs in there doesn't change that fact. But then understanding that there's a muscle in here, the obturator, that holds on to how your hip rotates. There's referral patterns of trigger points that refer, you know, right into the sacroiliac joint. If there's any nutation of the pelvis, which means one side's moving slightly forward or backward, or even an extreme tilt, as you were describing, your patient probably had that kind of tilt going on, so completely flat back. That could be, I haven't seen it myself, where does she have tightness in her linear elbow from scarring coming up there? Is that causing that? And then that would put undue stress here, because things are designed to absorb weight. Your spine is curved to absorb weight. Your arch of your foot is designed to absorb weight, so that you can take whatever it is 10 times your body weight if you're walking through the arch of your foot, because it'll do that. The arch of your knee, you know, your knee's always bent when you're walking, always slightly bent. But yet when I do balance with patients, they can stand with a, well, sometimes they can stand with a straight knee, but the minute I say bend your knee just a smidge, they don't have any balance. So, which means that they kind of throwing themselves from one side to the other because they don't have balance to actually stand on the leg long enough to actually stride forward, which again is going to put strain through these joints here. So that's going to say quite a pain.
It becomes almost like a controlled fall.
You're basically
each time,
falling forward.
as opposed to actually using your glutes to.
So you're not gliding forward. Now let's go back to the knees. Is how much impact does that have on the knees? Because every time you're kind of dropping onto the foot, and how often are women quite flat-footed after pregnancy because they drop their arches from the extra weight, or maybe the lack of estrogen, or whatever's going on. You get weight bearing forward onto the foot rather than onto the heel. So the arches start collapsing. Now you don't even have that shock through that. You're falling forward, extra impact on the knees. And you might have some historic, teenage issues like Auschwitz-Schwarzes and contamination of femoral pain syndrome that sit in the background, bubbling away. And then you put a pregnancy through that. And then life where you're picking up kids in the wrong way. People often want to protect their backs by using their knees, so overusing the knees and not using the hinge, where you really have to fire through the glutes to kind of get the upper body forward and back when you're lifting, pushing, pulling, carrying. Using that little hinge to brush your teeth, to sit down, to do a squat, all of those things. So it's so important to understand that you can offload the knees by doing so many different things, but also understanding that how that tension pattern, the adductors are going to contribute to that inward tilt of the knee, if that makes sense. Yeah.
And you see it collapsing into the knees, the flattening of the inner arches, which is why when we do the getting tall against the wall, it's all about from the feet upwards, up through the chain. And
it's rebuilding those bridges, isn't it? The arch of the foot, the softening in the knees, the correct tilt through the pelvis, so that you have that arch through the back and the head sitting on top. But I mean, then you move in a good way. Which then takes the load off.
God, I mean, to be fair, there is so much to it. And yes, we're passionate about anatomy and how we can optimize how the body functions, etc. And it's not everyone's cup of tea at all. But I do think as women, we do have a little bit of an onus to understand what is going on, especially around the pelvic area, so that we can understand what is kind of normal, what is physiologically normal, and what is not. And 100% not putting up with pain. Pain is your body's only way, really, of saying, help me, please give me some attention.
And understanding, perhaps, I mean, we're talking a bit about the biomechanical model of pain here, which is only one side of the story, actually only a third of the story. You've got, if we talk about the biopsychosocial approach to pain, we have to understand that the bio is the issues in the tissue. So I can say your pelvis needs to be doing this, and your muscles need to be doing that, and your estrogen levels need to be doing that, and you need more protein. These are all the issues in the tissues. That's one small part of it. But for my patients with chronic pelvic pain, that is really a small part of it. Then we have to look at what's happening with the psychosocial stuff. How do you feel about your pain? The Buddhist belief is that pain doesn't equal suffering. So if you're suffering terribly because of the pain you have, because of your belief systems around that, and maybe some stress in your relationship, or a child that might have issues at school, or whatever's going on in your own psychology, in your own belief systems, in your own relationships, is going to impact how much you suffer from that pain. So one patient will come in with exactly the same issues in the tissues as another, but the one has maybe a 3 out of 10 pain, and the other one has an 8 out of 10. They're really suffering, really impacting their life because of what's going on in the psycho side of stuff. And then you've got the social side of stuff, which is the pond you swim in. So I told you the analogy of Nemo with his little wing, with his little fin.
No, I like this. Like a Nemo fish.
So imagine Nemo with his little fin. But he was perfectly safe when he was in his little part of the ocean, which was really protected from the currents and the rest of the ocean. And he swam around with his friends. He didn't get left behind. He just had to swim a little bit harder with that fin, but it didn't cause him any problem. Now that's the issues in the tissues. He has a small fin. Not much that can be done about it. What are you going to do? So sometimes you have a prolapse. You have, something that's going on that you can't change. Okay. So first of all, we go change the things we can do, and we do the work. That's important. But sometimes you can't, and you have to accept that you have this issue in your tissue. Then you go on to think of the psycho. Now, to me, that's the current. So as soon as he came out of that pond, there were all these currents in the ocean. And now it's a little bit harder to keep up with that fin. And now the fin's a problem. Now you're kind of tired at the end of the day keeping up with your mates because you're swimming up against the current, or the current's throwing you one way or the other. But then we've also got to remember sometimes the ocean gets really stormy. and you're in the ocean, and that's the social. Now, these are the things you don't necessarily have any control over, you know, whether Boris is going to resign or not, what's going on in the Ukraine, what's going on in America with all these things that are being overturned that affect us as women. These things impact us. This is the stormy ocean. It really makes things muddy. Now you can't see, you're in a current and you have a small fin. Now you're suffering 8 out of 10. Do you understand?
God, that's good. I like
so
that.
I think we really have to understand that sometimes it's stuff you can control and sometimes it's stuff you can't control. So you do the things you can, and then you have to kind of accept the things you can't. And that's where yoga and breathing comes in as well. But also just understanding that sometimes, even if you're in a stormy ocean, you can lift your head above the ocean just for a second, take a nice deep breath. And I literally mean take a nice deep breath. You know, focus on those mindfulness exercises, focus on your meditation. That takes you into the calmer part of the ocean just for a moment, so that that little fin isn't bothering you just as much as it would, you know, dealing with those issues in your relationships or in your own belief systems. And that's the work of midlife, isn't it? As Brené Brown talks about, is do your work. You have to go look at the belief systems that don't work for you. I'm currently really rooting out a massive belief system for myself that Linda and I spoke about earlier. And it's hard, you know, you look at it because you so tie yourself, your identity into those beliefs, don't you? And you really have to remember your opinions are separate from you, and you are not what you think, you are not what you think about things, you know? So that's hard, and it does affect your identity, but you need to separate from that. So that issue in your tissue, and I can tell you, I've been so sore for the last few weeks because I understand this. And even though I understand this, I'm still in pain. But am I in suffering? No, I'm not. I just have to accept that the things that we can't change. So you're Nemo, you have a small fin, you're in the ocean with its currents. And at the moment, it's super stormy out there.
It is. I love that. I really love it.
Really
I had an analogy that I was taught many years ago by a lady called Donna Fahy, who's one of the world's preeminent yoga teachers, and she's a wise woman. And she gave this example, which is similar, of a jet taking off from the ground. And as the jet goes up through the atmosphere, it's going to hit turbulence. And as it goes through the cloud cover, it's going to hit turbulence, and you are going to be battered around. Yeah. And then you get through the cloud cover and you get up to the jet stream. And at the jet stream, it's calm, it's smooth. You know, the jet stream is always there, always above whatever clouds and whatever is going on in the atmosphere below. And then at some point, you're going to have to come back down through that turbulence in order to get back down to the ground. But when you know that jet stream is there, always, it's like that in a North Star. When you have gifted yourself the tools of breath work, you know, we breathe from the moment we are born to the moment we die. And when you have mastery over your breath and you have an ability to drop down up into that jet stream, then you can recognize all the fluctuations of life as being exactly that. And you're not bounced around quite to such extremes, because you know that
your core truth is different.
Your core truth is not all of the stuff. And now that's one of the gifts of yoga. Yes, physically we might get nice long muscles and strong bones, etc. But actually, that's such a tiny aspect of it. The gifts of yoga are the ancient wisdom, the yamas and the niyamas, and the ability to calm the mind, etc.
I remember years ago when I started doing Kundalini yoga, the mantra was that if you control the breath, you control the mind. And I absolutely love that, because even now when I start getting anxious, or an issue grabs me, I'll just go, just control your breathing, because then you control your mind. You don't allow your mind to just run away with you and upset you. I love one of the British expressions is don't upset yourself, because that's so, it just throws the ownership right back at you. I got upset. No, don't upset yourself. That's what we do. We do upset ourselves. And I think understanding that when you control the breath, you control the mind, and you don't upset yourself. The issue might be upsetting, but you don't have to upset yourself.
And you're like the word you said before about the controllables. There are so many things happening, and we can't control everything, and that acceptance of that is essential. But we can control some things. We can learn how to breathe. We can control how we react to situations. We can control what we choose to bring into realm. My sort of mantra in my yoga birthing is be in control of letting go of being in control.
Yeah.
So we are conditioned, many of us, to feel like we have to have things, especially women, God, don't we? We've got to know what our children are doing. We've got to control as much as we can because we're juggling all of these things. But there is a real art, and it is an art as well as a science, actually, to being actually able to choose, so being in control of letting go of that need
to control. Yes, absolutely.
That's the key to birth without trauma. Without psychological trauma. Yes. Physical trauma.
That's so true. Actually, that brings me to one last little point I'd like to make is, looking at these women menopausally, and what took my journey into postnatally was that kind of pain patterns. And then I'm looking now at these women and I want to see them during their pregnancy and possibly even before they're conceiving, because then we can look at some of those biomechanical issues. Is there an issue with the pelvis? Is there muscles that could work better, or could we downtrain some stuff before you go into a pregnancy and then a birth, which might end up with trauma because you have a tight, high pelvic floor, for instance, which then just is going to have to tear, isn't it? Because if you want to get a baby out of it, either you're going to end up in an emergency C-section or possibly a tear. Are these muscles suddenly going to magically become nice and long and supple? I don't think so.
No. I used to, could tell in my birthing class, my prenatal classes, invariably, if they were a Pilates teacher, they're going to have a long labor because they're all apart. And it's a big thing for many of us A-type personalities to learn the art of letting go.
So tough,
and that's not just up here, that's physically. And that's why, my Monday night class, the release and replenish is so friggin' important. So important. If you're leaking, if you've got pain in the pelvis, if you've got pain in the lower back, if you've got urgency issues or stress issues, you've got to do that stuff first. It's foundational. Release. If you can feel that it's like a knotty, horrible sensation inside, if sex is painful, if it's hard to do a poo, go and see Elrina.
Kind of red flags, isn't there? They're waving at us and we just ignore them and go.
Yeah. So what's our overall umbrella message?
I think it's to get help and to share with other people that there is help for any kind of pain issues that you have, but also understanding that pain issue fits within a wider framework. All of which have controllables.
Yes.
And uncontrollables, and knowing the difference between what's one thing and what's the other.
And I would add in, if you're in midlife and it feels like all of the tabs are open and there's so much going on, and the universe is going, while you're overwhelmed, I'm just going to throw at you all of your past trauma as well, because why not?
Yes.
Then know that you're not alone. Part of it is hormonal, and part of it is, as Brené Brown said, midlife is the time when the universe just taps you on the shoulder and says, I'm not fucking around anymore.
Got to do this work.
You've got to do this work. Then invest in yourself. Now is the time to invest in yourself. Little Johnny can not have piano lessons this year, if that's the case, but invest in yourself in time and in effort and in money, because it will pay dividends for the rest of your life.
That's absolutely true. Yeah. That's us.